Hello, everyone, and welcome. My name is Laura Siren, and I'm President and CEO of Diabetes Canada. I'm very happy to be your host for the Diabetes Canada Telephone Town Hall meeting. Tonight, we're joined by DC staff member Dr. Rachel Reeve, who is the Executive Director of Research and Science at Diabetes Canada, Dr. Mary Jung, who's an Associate Professor at UBC and a Diabetes Canada funded researcher, and Grant Maltman, another staff member at Diabetes Canada and the curator of Banting House, National Historic Site in London, Ontario. Before we get officially started, I want to begin with a land acknowledgement for the land that I'm currently occupying here in Toronto. I want to acknowledge that the land we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also want to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And I want to take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. So thank you so much for joining me in that land acknowledgement. And now let me explain a little bit about how the Telephone Town Hall is going to work. Right now, Diabetes Canada supporters across Canada are answering their phones and connecting into this discussion. In a way, this is a bit like a traditional town hall, where guests arrive and file in through the front door. Except in place of a front door, there are thousands of phones ringing throughout Canada. Once someone answers their phone, they just stay on the line to join this discussion. For those who miss the call, an answering machine message will be left with directions on how to call into the discussion. This telephone town hall technology enables us to reach out and talk with thousands of people from the comfort of their own homes. It's such a great way for us to stay connected with our supporters, ensure that they and you get the latest updates about our work. And for those of you who have just been joining the call, welcome. This is a telephone town hall with DC staff member Dr. Rachel Reeve, who's our Executive Director of Science and Research here at Diabetes Canada, Dr. Mary Jung, an Associate Professor at UBC and a Diabetes Canada funded researcher, and another staff member at DC, Grant Maltman, the Curator of Banting House, National Historic Site. And I'm Laura Siren, President and CEO of Diabetes Canada. I see we still have some more phones to call. So as we wait for everyone to join, I'd like to welcome my colleagues who are on the phone. And in particular, I'd like to welcome Grant Maltman to the call and ask him to share a little bit about Banting House, the National Historic Site. Welcome, Grant.
Well, thank you, Laura, and good evening, everyone. Greetings from London, Ontario, the birthplace of insulin, the site where arguably the most important breakthrough in the history of diabetes research and management occurred and set in motion a chain of events that led to the discovery of insulin. We are located on the traditional lands of the Anishinaabe, the Haudenosaunee, the Lenape, and Audouindron peoples. We honor and respect the history, languages, and culture of the diverse Indigenous people who call this territory home and the 6 treaties that are specific to this area. At its core, this incredible life-changing discovery of insulin is a story of triumph over failure, life over death. This evening, I'd like to take you on a brief journey through time, almost 3,500 years to be exact, and put the incredible events of the insulin period into perspective. The history of diabetes research carried on for centuries, where individual successes could be considered minimal in the larger context. But together, it laid the groundwork for Banting and the Toronto team and led to an immeasurable success which occurred over a brief period of 3 years. That context and the serendipitous nature of the events that led to the discovery of insulin is what makes this story fantastical. For many, the discovery of insulin is looked at from the perspective of a single moment in time, that famous 1921 photograph taken on the roof of the medical building at the University of Toronto. It features Charles Best, Dog 410, and Frederick Banting. But like any other story, that image is neither the beginning nor the end. Nor is it real. It's actually a staged photo. Our story actually begins in 1552 BCE and the Ebers Papyrus, the world's oldest surviving medical text. This parchment has come to be accepted as the earliest recording of the diabetes condition. We believe it's to be written for someone as a prescription for someone with sweet-smelling urine. It was not until the 4th century BCE, the Hippocrates, a name many of us are familiar with, observed and noted that when a lot of urine is passed soon after drinking, the recovery from this disease is very doubtful. 600 years later, in the 2nd century CE, Galen diagnosed the disease as the weakness of the kidneys and suggested that the leanness of the patient with diabetes was a result of the inability to metabolize nutrients, which were then passed in the urine. Then, more than 800 years after that, Avicenna in the 10th century CE offered that gangrene was associated with frequent urination and that diabetes could be related to such complications as non-healing wounds. I think we can all start to see a pattern here. Very few things happened over a great period of time. Which brings us to 1869, when German medical student Paul Langerhans announced that he discovered that the pancreas contained 2 systems of cells, one of which would later come to be known as the islets of Langerhans, but he had no idea as to their function. Then, 30 years later, in 1889, Oskar Minkowski announced a direct connection between the pancreas and diabetes after removing the pancreas from dogs and later rabbits and pigs. It was a game changer. It took 3,441 years to get to that point, and the only effective treatment for diabetes, a term I use loosely, was the Allen starvation diet, which sometimes allowed for a maximum of 400 calories per day. Developed in the early 20th century, it supplanted previous treatments, which included the consumption of large quantities of sugars to replace what was being lost in the urine, opium, the oatmeal diet, the milk diet, and even the rice cure. Despite these measures, the prognosis was not good. Life expectancy was generally 6 months to 2 years. Here's where we come to that fantastical part of the story I hinted at earlier. A failing private medical practice led a young Frederick Banting to secure a position as a demonstrator in surgery and anatomy at the Western University Medical School. On October 30, 1920, he read all he could about diabetes and carbohydrate metabolism while preparing a lecture he was to give on November 1st. That evening, he took a surgical journal to bed with him and came across an article written by Moses Barron. It was a survey article on his own diabetes research at the Mayo Clinic. We are lucky to have Banting's own words to describe what happened next. It was one of those nights when I was disturbed and could not sleep. I thought about the lecture and about the article. Finally, about 2 in the morning, after the lecture and the article had been chasing each other through my mind for some time, the idea occurred to me. I got up and I wrote down the idea and spent most of the night thinking about it. Western simply lacked the facilities, equipment, and frankly expertise to conduct the experiment Banting proposed, so he was encouraged to take his idea to the University of Toronto and seek the support of noted professor of physiology, J.G.R. MacLeod. The meeting at first did not go very well. From MacLeod's notes, I found that Dr. Banting had only a superficial textbook knowledge of the work that had been done, and he had very little practical familiarity with the methods by which such a problem could be investigated in the laboratory. But Banting was persistent, and MacLeod began to show interest, although that interest was likely directed more to the value of Banting's failure than his success. MacLeod offered him a lab that needed cleaning, 2 graduate students, 8 dogs, and a start date of spring 1921. On May 17th, Banting arrives in Toronto and is introduced to Charles Best, a student needing a summer job. MacLeod showed them how to operate on dogs and left them to their work. Within weeks, on July 30th, they tested their somewhat crude extract, resulting in limited success. While the blood glucose dropped in the specimen, it died shortly after from the impurities in the extract. With some further guidance from MacLeod, the experiments continued, and in December, they were able to verify the validity of their observations through Marjorie, a dog who had been treated with the extract for 75 days. It was about the same time that Leonard Thompson was admitted to Toronto General Hospital. Having diabetes, he was 13 years old and weighed 65 pounds. On January 11, 1922, Banting and Best tested their formula on Leonard, and the test was deemed a failure as there were still too many impurities, and it caused a reaction at the injection site. 2 weeks later, on January 23rd, almost 6 months to the day of that stage photograph with a dog, Dr. James Collop, the 4th man on the team who had joined in early December, produced a more purified form of the Banting and Best formula. Leonard's father consented to another test. That consent resulted in the first successful use of what we now call insulin in a human patient. Leonard would live for another 13 years until his death from pneumonia at age 27. The modern era of diabetes management, nearly 3,500 years in the making, had begun. Thank you.
Thank you, Grant. For those of you who have joined during Grant's talk about the discovery of insulin, I want to welcome you. I'm Laura Siren, President and CEO of Diabetes Canada. And if you're just joining us, tonight we're here with DC staff member Dr. Rachel Reeve, who is the Executive Director of Research and Science at Diabetes Canada, Dr. Mary Jung, who's an Associate Professor at UBC and a Diabetes Canada funded researcher, and Grant Maltman, who some of you have just heard, who's the Curator of Banting House, the National Historic Site for the Discovery of Insulin in London, Ontario. We're all here for this telephone town hall to give some updates on the important work happening here at Diabetes Canada. This telephone town hall is live and interactive, which means you can ask questions of any of our speakers, including myself, at any time. If you have a question for myself or any of the three other speakers, just press *3 on your phone, *3 at any time to let us know you'd like to speak live on the call. What will happen is an operator will take down your question and put you in line to ask your question live. You'll still be able to hear the town hall conversation while you're waiting to ask your question. And when I call your name, you'll be able to ask your question live on air. As well, we're able to do quick real-time poll questions on this call, and I'd like to do one right now. So the first poll question, and you're going to have 4 potential answers, is what part of Diabetes Canada's mission do you feel most passionate about? So if you feel most passionate about ending diabetes by finding a cure, please press 1. If you feel most passionate about reducing the serious health complications caused by diabetes, press 2. If you feel that improving the day-to-day lives of those living with diabetes, and by the way, that includes me, press 3. And lastly, if you're most passionate about preventing diabetes in the first place, press 4. So I'll say that quickly again. The question that we want you to answer is, what part of Diabetes Canada's mission do you feel most passionate about? Press 1 if it's ending diabetes by finding a cure. Press 2 if it's reducing the serious health complications caused by diabetes. Press 3 if it's improving the day-to-day lives of those living with diabetes. And press 4 if it's preventing diabetes in the first place. And so we'll let people vote, and thanks to everyone who's participating in the poll. And it's really exciting because we have hundreds of Diabetes Canada supporters already in the town hall, and there's still a number of callers getting connected. So we will be answering your live questions shortly in just a couple minutes. But before we get to the first question from the callers, I'd like to welcome officially Dr. Mary Jung. Mary is an associate professor in the School of Health and Exercise Sciences at the University of British Columbia, Okanagan campus. Her major research interest is in developing evidence-based diabetes prevention interventions, so she hopes you vote for number 4, designed for community implementation and sustainability, with a lens towards improving equity, diversity, and inclusivity in all research endeavors. Dr. Jung has received over $9 million in competitive research funding as principal investigator for her studies on exercise adherence. Mary leads the Diabetes Prevention Research Group, is a founder of the diabetes prevention program called Small Steps for Big Changes, and is director of UBC's Center for Health Behavior Change. Mary, can I turn it over to you to talk a little bit about your research?
Yes, thank you, Laura. I really appreciate being on this call tonight with everyone. I'd love to share a little bit about my Diabetes Canada funded research, which is really evaluating the implementation and long-term effectiveness of a diabetes prevention program my lab developed called Small Steps for Big Changes. So we're looking at scaling this out to remote and rural communities in northern BC. I'm very passionate about this project as this funding enables us to really reach communities in need. So we know that remote and rural communities in Canada are particularly challenged by dispersed geography, by limited access to internet and healthcare providers, and built environment barriers, things like no access to exercise facilities. So diabetes prevention programs have been created and they're certainly effective. Many have shown effectiveness in laboratory settings and some even in major urban cities, but none have been designed specifically for the needs of our Canadian rural communities. So Small Steps for Big Changes is a 3-week diabetes prevention program designed specifically for feasible translation into communities. It's brief, it can be implemented virtually or in person, and it requires no specialized education or experience to deliver. Through this research, my lab, alongside with our community partners, is able to offer rural communities the ability to feasibly implement and sustain real-world diabetes prevention solutions.
Thank you so much, Dr. Jung. As someone who lives with type 2 diabetes myself, I'm really excited to see the fruits of your research work, because I know that adhering to my exercise routine is easier said than done. So again, if anyone has a question about Dr. Jung's work, please press *3 on your phone and you can get in our line for questions. An operator will take down your question and put you in line to ask it live. For everyone who's just joined, because I do see we have some folks still joining, my name's Laura Siren, President and CEO of Diabetes Canada, and I'm joined by 3 folks tonight. Dr. Rachel Reeve, who's Executive Director of Research and Science at Diabetes Canada, Dr. Mary Jung, who was just speaking, an Associate Professor at UBC and a Diabetes Canada funded researcher, and Grant Maltman, Curator of Diabetes Canada's Banting House, which is a National Historic Site in London, Ontario. Now, just remember, if you'd prefer not to ask your question live on air, but you do have a question, you will have a chance to leave it for us, leave a message for us at the end of this event, and we can get back to you. I have one final introduction to make tonight before we get to the questions, and I see them lining up. It's my pleasure to introduce the Executive Director of Research and Science here at Diabetes Canada, Dr. Rachel Reeve. Rachel, over to you.
Thank you, Laura. I'm really pleased to be on this call tonight with everyone. I'm a scientist. I did a PhD at the University of Toronto in the Faculty of Medicine, specializing in stem cell biology and genetics. And my undergrad is in physiology from Western University. I love science, and my time at graduate school exposed me to a research project that I led, scientific conferences where I had the opportunity to learn about so many other research topics, and the importance of funding for science. It takes working in a lab to understand how many research ideas are sitting waiting to be funded, and those ideas can lead to breakthroughs and propel treatments forward. Together, the fact that I so much enjoyed learning about many research projects and how crucial it is to support research in Canada is what led me to move from academia to a research funder role. Here at Diabetes Canada, I have the opportunity to help advance research by guiding how DC invests in research, and this includes overseeing the research strategy and the types of research funding opportunities available to researchers. We host an annual grant competition where researchers from across Canada, like Dr. Jung, can apply with their research projects to request funding. We select the top scoring research projects as determined by a panel of reviewers who are all experts in their fields and recommend those projects to Diabetes Canada's board for funding. Right now, DC is supporting 55 research projects, and we're in the midst of reviewing this year's applications. We received 110 projects this year, and we're looking to award another 20 by the end of the year. This will lead us to 75 currently funded research projects, which cover biomedical research, clinical research, and research about how we deliver care to people living with or at risk of diabetes. These projects span type 1, type 2, prediabetes, and gestational diabetes, and there's topics including prevention, treatment, avoiding or managing complications, access to care, and search for a cure. Another part of my role is being the voice of science at the organization, and this gives me the opportunity to share the breadth of the research that Diabetes Canada is investing in, and to share the progress and impacts of those projects. It's important, it's opportunities like these ones this evening, where we get to hear directly from researchers about their work and the impact the project is making for people who are at risk of or live with diabetes. And communicating the outcomes of a research project is so important. Research isn't confined to the lab or university that it occurs at, and it needs to be shared widely. Research also isn't an individual sport, and there are full teams around funded research projects, as well as many collaborators who come together with stakeholders to further successful research projects so that it is implemented and reaches people living with diabetes. This is part of knowledge translation and implementation of research, and it's absolutely key and so important as we think about making a difference in the lives of people living with diabetes. That provides oversight of my background and role. And as with Grant, Laura, and Mary, please, if you have a question for me, you can press *3 on your phone and to get in the question line.
Perfect. Thank you so much, Rachel. This is Laura Siren again, and it looks like we've got a number of questions from our callers. So I'm going to get to those now. And remember, just as Rachel just said, if you want to ask a question, just press *3 on your phone. You'll get connected to an operator who will take down your question and put you in the line to ask your question live. And if you don't want to ask it live, if you just rather leave a message or comment, you're going to have an opportunity to do that at the end of the town hall. So we are going to start with Jane from Toronto, and she actually has a question about prevention. And so I am going to ask you, Jane, to state your question, and then I think given it's about prevention, I might ask Mary to answer first, and then maybe Rachel and I can tag team on there. Jane, over to you.
So who am I speaking to now?
You're speaking to Laura.
Okay, to Laura. So, Laura, I thought that diabetic, you had found a cure for it, but I just see that people take pills and they don't seem to stick to the diet, what they're supposed to. So, what actually are you doing so that there will be a permanent cure?
Yeah. It's a great question, and maybe I'll answer it first, and then I'll turn it over, Mary, to you to talk a little bit. Is really the rate of diabetes isn't in decline; it's growing, and people have tended to think insulin is more than a treatment; it's a cure, and it's not. So, thank you for that question. And so there's a number of things being done to try to really get to a cure. The first is, as we were talking about, is funding research and trying to really take that next step from treating it with insulin and letting people live longer and healthier lives to actually being able to cure it. The other thing we're really trying to do, Jane, is work at prevention and trying to get people who are either pre-diabetic to get to better levels, or even people who haven't got diabetes yet. So maybe, Mary, could I ask you to speak to that a little bit?
Sure. Thanks so much for your question, Jane, and I understand where you're coming from. It certainly can be frustrating or confusing to witness all the increasing rates of many types of diabetes. I think when we are attempting to assist people from preventing it in the first place, it also takes that adherence or compliance, continuation of pills or continuation of behaviors. So things like diet, a healthy diet, and following an exercise routine. As we all likely know on the call, some exercise and diet and even taking medications, although it seems straightforward on paper, when we get to do our daily lives, which are often busy and complicated, it creates more barriers to doing what we know we should do and actually applying them to our lives. So I think there's great advances in the preventative side of type 2 diabetes, and we've still got a bit of a ways to go to be able to expand our answers in that role to, across the country to our large country.
Thanks, Mary. And Rachel, do you want to add anything to Jane's question, to answer Jane's question?
So I'm happy to add. I think as we think about prevention, I'll add a bit to Mary. There's so many different. We think about the diverse population living in Canada, and we think about the treatments available. We know that we need more treatments, and that lots of people will benefit from different approaches, different therapeutics, different exercise regimes, and different lifestyle changes. And so when we look at that research that Diabetes Canada is supporting, it's so important to look at that breadth of research and think about all the different ways that we can start to chip away at the iceberg and really have treatments that are efficacious available for different lots of people living with different types of diabetes.
Thanks, Rachel. And next question, I'm going to get to Eleanor in Calgary. But just before I do, I wanted to just announce the results of that poll we took earlier. And we asked, what part of Diabetes Canada's mission do you feel most passionate about? And almost half of you, 43%, said you were passionate about ending diabetes by finding a cure. Actually, just relates to Jane's question right there. The next highest number at almost a quarter, 26%, was preventing diabetes in the first place. So folks either don't want folks to get it or find a cure, which makes a lot of sense. So now I think we'll go to Eleanor in Calgary. Eleanor, do you want to ask your question?
Yes, I have just been told that I am probably diabetic because I had 2 results at 6.5 sugar level. I am 85 years old, and I'm completely surprised at this announcement, and I don't know. I haven't been told. I haven't been sent to a specialist. What am I supposed to do? How am I supposed to control this? What can I do to prevent it from becoming worse?
Yeah. Thank you, Eleanor, and sorry to hear you've had that diagnosis. And the good news is there's lots that you can do to help reduce those numbers and continue to live a healthy life. One thing, for example, is on our website, which is just diabetes.ca. There's lots of great recipes for diabetes-friendly meals. There is nutritional information about how you might think about your menu planning and what you have to eat, getting some more exercise. We also have a 1-800 line that you can call, and they can point you to more resources. You may also want to ask your family doctor or where you got your diagnosis, whether they can refer you to a dietitian. Do they have one on staff, or is there someone local that they go to? Because there's lots of certified diabetes educators and dietitians who can really help you. So, for example, when I got diagnosed, Eleanor, with type 2, I was also very shocked. It wasn't anything I was expecting. And my doctor was able to put me on to a dietitian who was actually, I don't know if I'm allowed to say this out loud, but I'll say it. It has almost been more important to me than my family doctor. So lots of places to go. And Mary and Rachel, I don't know if you'd want to add anything to that.
Sure, I'd love to jump in. Thanks so much, Eleanor, for sharing your personal story. I loved your optimism and how you started with really saying, what can I do now? What's in my control to prevent anything from getting any worse? And I think a lot of healthcare providers would certainly agree with you that you're on this cusp of wonderful opportunity to reduce your blood sugar levels, as you said, and as Laura confirmed with her own experience, modifying things in your diet, increasing your physical activity can really visibly and sizably or clinically reduce those blood sugar levels. So you're absolutely in a place of hope. And the fact that you're calling in today, I can tell you're motivated to make those personal changes. And with assistance from a diabetes educator and a dietitian, I absolutely think that there's good hope in your future.
Okay, perfect. So we've got a number of callers, and the next one, I'm going to go to Tom in Winnipeg. But before I do that, Tom, before we put you live, just want to remind everyone that if you have a question, press *3, and you'll speak to an operator, and they'll take your question and get you in the line. And just before I go to Tom, I just want to do another quick poll because we're always interested in hearing what you're interested in. So what I'd love to know is if you get communications from Diabetes Canada, what would you be most interested in hearing about? So press 1 if it's learning about research updates. Press 2 if it's about advocacy updates. What are we doing to work with governments to make life better for people with diabetes? Press 3 if it's program and service updates. And press 4 if it's diabetes-friendly recipes. We were just talking to Eleanor about that. So again, press 1 if you're most interested in hearing about research updates. Press 2, advocacy updates. Press 3, program and services. And press 4, diabetes-friendly recipes. And don't worry, this is just to get your sense of what you want to hear about. You won't be contacted by anyone. So let's go next to Tom in Winnipeg. Oh, Tom doesn't want to go live. Sorry, Tom, I'm seeing this. So here's Tom's question. I have type 2 diabetes, and I'm wondering if it's brought on by stress. And if so, how do you prevent it? It's, to me, a great question. And Mary and Rachel, I'll see if you want to add anything to that before I share some personal thoughts about that.
Sure, this is Mary speaking first. I hope that's okay, Rachel. You can chime in and correct me where I go wrong. So, Tom, absolutely, there's really groundbreaking research right now happening, looking at the relationships between mental health, one of those factors, a key one being stress and anxiety, and the prevalence or, the likelihood of type 2 diabetes in individual experiences. So I can't say for certain at this point that one brought on the other. Right now, the research is looking at that relationship and trying to understand and unpack which one comes first, or maybe they're coming on at the same time by compound or something else related. But I think in terms of both, looking at the reversal of type 2 diabetes as well as reductions in stress, there is opportunity for both to be improved on. So stress reduction and reduction of blood sugar levels. So I think that there's, expertise that can be provided for both of those factors. And I'll maybe perhaps send it over to Rachel now to chime in.
Yeah, anything to add, Rachel?
Yes, I'll add that it's an important area of research, and there, as Mary said, there are lots of projects in this area right now. And I think it's important to think about, as Mary mentioned, there's the mental health aspect and how that might contribute to a risk of developing or diabetes or progressing to diabetes quicker. There's also projects happening at the biomedical level, thinking about the stress on cells. And so it's interesting how this type of project, it's reflected across biomedical research and across health services or clinical research. We think about all the different ways that stress could affect a person's body or a person's cells, and it's a really interesting and really important area of research to pursue.
Thanks so much for that, and that's a great question, and something certainly that I've had conversations with my family doc about the role of stress in not only me potentially being diagnosed with diabetes, but also in managing it well and thinking about all the ways that exercise and other things can deal with that. So we're going to go next to Donna in Alberta, but before we do, I'm just going to share thanks for those of you who took part in the poll. It was, what are you most interested in hearing about? And coming in at 46% was research updates, followed at about half that by diabetes-friendly recipes, and then program and services and advocacy updates. So lots of people wanting to hear about research, which is great. So Donna, from Alberta, could I ask you to give us your question?
Yes, you sure can. I should qualify this by saying that I've lived with diabetes type 1 for 54 years and would like to live a lot longer. I'm concerned about access to basic care for effective treatment First of all, I fully appreciate and applaud the work of all the professionals. We've come a long way over the years. But I live in a remote area, and for many of us, it's hard to get a family doctor, or even harder to access an endocrinologist. So what can be done in terms of advocacy for people who are unable to get basic care from a family doctor who deals in generalities, never mind accessing someone that's more specialized with current improvements and trends in diabetes management?
Yeah. Great question. Really great question, and very timely, Donna, because we know for many folks, an increasing number in Canada, they're unattached. They do not have access to a family physician, let alone an endocrinologist. So I'll answer a bit, and then Mary, I know yours is more on the prevention side, but we're talking about sort of folks that are more rural or more remote, and getting them access to the right things. So one of the things we're doing with our advocacy efforts very much is focusing on thinking about how people who don't have family physicians can still get ongoing regular screening. So, for example, in Quebec right now, the government's piloting a really interesting project where they have a list of unattached patients, and they're actually linking them to our sister organization, Diabetes Quebec, to do an 8-week sort of education program while they're waiting to be attached. There are, of course, one of our key advocacy issues is making sure that people have access, and timely access, as you were saying, Eleanor. And that's especially post-COVID, increasingly hard, but something we're working very hard with. We got a national framework for diabetes called a Diabetes Framework in Canada, and in it, it calls for equitable access to primary care and to specialists. So working as much as we can, actually with some research, for example, eye screening. Can you do it remotely? There's a really interesting research project in Ontario that we're working with the Ontario government of can we then expand this, et cetera. So no easy answer, I would say, but lots of work trying to very aware of the issue, and then trying to pilot effective research and programs. And maybe I'll ask Mary if she wants to add in there.
Sure. Thanks so much, Donna. And just really highlighting what I believe as well is that, remote and rural access to healthcare is not there's room for improvement, and certainly you are living proof of somebody doing that really well. So I think we should be asking questions to you. But to answer or to try and add to what Laura mentioned, I think there is excitement in the virtual health that COVID perhaps expedited healthcare delivery. We're using virtual programs as well for our delivery of remote and rural prevention programs. We also train healthcare providers through an online platform now, and so that really, I know it's not the tomorrow answer that you're likely looking for, and although I don't specialize in type 1 diabetes, there is these emerging programs that are showing really strong promise, effective or even more effective than face-to-face in-person care. And so I think your concerns and the awareness of the lack of availability in remote and rural communities for people living with diabetes is growing, and so these programs that are trying to solve that are coming. If that sheds any optimism, perhaps.
Yeah. Thank you so much. I'm going to do one quick question before we do our final poll for the night. And I hope I'm pronouncing your name right. Shula Miss in Toronto, do you want to come on live and ask a question?
I'm
okay,
online.
Perfect. What's your question? Yep.
My question is this. Sometimes this past year there was an article in the newspaper of someone's daughter who died from diabetes because they could not afford the insulin. And my question is this. could not your organization also have some type of funding to give private individuals the funding they need for insulin? And then one of the ways might be a card, like a type of credit card that can only be used for insulin only in a pharmacy. So there's no fear of the money being used for something else. If could the diabetic organization do address this need for people who need insulin?
Yeah, it's a really important issue, and it goes even beyond insulin in terms of affording medication. For us, the cost that it would take to provide insulin for all the folks who need it is very great. Where we work very hard to make the difference is to do a couple things. First is many of the companies who produce insulin have what they call patient partner programs or patient support programs. And so we do a lot of, and that's for people who are having trouble affording their medication or have questions about could a benefits program be covering this and I'm not aware of it. So we do a lot of linking to people to other places where there are already abilities for people to get discounted rates, etc. The other thing that we are doing is to advocate for reductions or more coverage, let me put it that way, for things like monitors, because those are also quite expensive, insulin pumps, and trying to get governments to increase off. Many governments across Canada will cover costs up till the age of 18. And then after 18, they won't. So we've had a couple great examples over the last year of where we've got governments to either move up to 25 and will cover it, or actually remove the age restriction altogether and cover things through the drug plan of that province. So it's a very important issue. There's not an easy answer to it, but it is something that we try very hard to link people to where there are opportunities to offset those costs. Okay, the next one, we are going to go to Darlene in Victoria, BC. But before we do, as I said, third and final poll question today is, I'd love to know if you can answer, there's going to be 5 options in this one. What is the top reason you're part of our community here at Diabetes Canada? We had your phone number and you're linked to us, and we'd love to know why. So press 1 if it's because Diabetes Canada aligns with your values. Press 2 if it's because you think we make a real impact. Press 3 if it's that you trust how we spend the donations. Press 4 if it's because you feel your donations are needed. And press 5 if it's because you're clear on what your donations achieve. So again, what's the top reason you're part of this community? 1, because Diabetes Canada aligns with your values. 2, because Diabetes Canada makes a real impact. 3, because you trust how donations are spent. 4, because you feel your donations are needed. And 5, because you're clear on what your donations achieve. So thanks for those of you who are voting. And while we're waiting for those poll results to come in, Darlene from Victoria, BC, could you ask your question live on air?
Yes, hi. I have a question regarding, our grandson was diagnosed with T1D when he was 9. He's 13 now. And it'd be really nice to be able to give him some hope for the future. A lot of times I think children, they know that they're living with a serious disease, and we don't want to give them false promises, but I want to be able to encourage him that improvements will be on the horizon and he can live a long, healthy, happy life. So can you guys offer me that? Some support around that issue?
Yeah, great question, Darlene. Rachel, could I ask you to answer that first?
Yes, happy to. It's an important question, so thank you for asking. I mean, I can understand. I appreciate your note about so much, like the desire for hope and you don't want to offer false hope, because research takes time. But and I want to share, there's so much exciting research underway. When we think about the progress that's been made, progress in research, it does continue to accelerate. So when we think about insulin being discovered 100 years ago, the breakthroughs happening now, they happen at a much quicker pace. And we can think about, Diabetes Canada supporting projects, thinking about how to transplant stem cells. It could be how you encapsulate them, how do you deliver them into the body so that way they're not attacked by the immune system. And those stem cells could provide long-acting, we'll call it a long-acting treatment, and in the path towards a cure to continue to release insulin. You also think about all the artificial pancreas projects and how much impact is being made there. And so there's so many avenues of research all working towards this goal of a cure. And there's so many different ways to come about it that's really exciting, that there's so many different types of research projects that could hold great promise for the future. And it's really important that we think about these future breakthroughs that could lead to a cure, as well as what can we do now to improve quality of life. And so we think about even just how far technology has come in the last 10 years. We think about continuous glucose monitors and linking it to a pump. It's infinitely better, and we think about how much of an impact on people's day-to-day lives that can make. And so in the meantime, it's so important to think about what can we do to improve treatments now while we wait for breakthroughs of the future.
Okay, thank you, Rachel. And I was just at a talk where someone who got diagnosed many years ago, like one of our earlier callers, talked about also giving hope to some of the younger folks is the skills you're learning when you live with type 1 diabetes are they might seem overwhelming and you wish you didn't have to learn them, but they're also something that, in his words, you can turn into your superpower: resilience, perseverance, thinking ahead, project management. And so it's not a great diagnosis, but you can find lots of other people who live with this, and you can find inspiration and hope in them, but you can also think that this is going to make you stronger. So that's another way to look at it. And as Rachel said, there's so much coming down the pipe in technology and in research about the pancreas and stem cells. So I think there's lots to hope for. So I'm going to take one final question before I talk about the poll results. And I'm not sure if the first name, I think it's Art from Bruce Mine. Art, I think it's you. Do you want to ask your question?
Hello?
Yep, you're live.
Okay, my question is, I'm an Indigenous person, and diabetes seems to be rampant amongst the Indigenous people. And with everything, all the research and stuff into genetics, is it a genetic issue with the Indigenous people? And if so, can something be done to modify the genetics?
Rachel, do you want to start on that, or Mary, do you want to start on that?
Yeah, sure. I'm happy. This is Mary. Oh, Rachel,
sure.
Do you want to?
No, go ahead, Mary. I'll add on after.
Okay. Well, first off, I just want to thank you and honor that question. It's definitely a problem we're well aware of in Indigenous communities. And from the perspective I take in research, which is on the psychological and social environmental impacts of where we live and how we live, I study the modifiable factors that can help us prevent type 2 diabetes. So I'll give Rachel the tough question on genetics, given her PhD background there. But all I'll say from my side of the question is that I hear your frustrations, and we really are working hard to be able to offer solutions that are co-developed and work specifically for Indigenous populations, and respecting that is not going to be a one-size-fits-all solution, that we really need to learn from the expertise that are held within Indigenous communities for both the prevention and the management. And so that's work that takes time, but I know it is happening. There's so many great Canadian researchers learning from Indigenous communities and trying to develop better solutions. Perhaps I'll turn it over to Rachel.
Thank you, Mary. Your question, it's really spot on, and it's at the forefront of lots of researchers' minds as we think about how to better care for people across Canada. And supporting and funding research, it needs to recognize that the causes and the management of diabetes are complex. And as you say, it includes biological pieces, it includes genetics, and it also includes environmental and social determinants of health. And it's so important that as we think about supporting research projects, that as we're developing treatments, we're thinking about how people are going to access them. And we're thinking about all the different ways that people are in need of better healthcare in Canada. You think about the technologies becoming available, as the question earlier about access to insulin if you can't afford it. What good is a new technology if you can't afford it? And you think about getting to a clinic to go through a new treatment or to even access your prevention program that Mary spoke to, although I noted, Mary, that you mentioned some virtual access. But even getting to care, we really need to think about the geography of Canada and people from coast to coast to coast as we think about research projects that are impactful to people living with diabetes. And your question, I know it's really specific about the role of genetics, and I think it's really important to continue to understand that, because as we think about health equity, understanding all the different types of diabetes, or the different contributing factors to diabetes and the different contributing effect of those factors, linking back to the stress comment earlier, it's so important to consider as we think about potential treatments or potential care models, and it really is a complex condition.
Thank you, Rachel. Yeah, great question, and I think genetics, not only in whether there's a genetic element to diabetes in Indigenous communities, but I think the role of genetics in diabetes, both type 1 and type 2, is certainly an emerging area, even why some people respond to medication and some don't, and is there a genetic component? So I think the answer to your question there, Art, is there's lots of different reasons why the prevalence of diabetes is so high, and one of those might be genetic. So before, I'm going to take a question from Dave in Fort McMurray, but before I do, I just want to share the results of that poll, which was the top reason why folks on this call are part of the community. And coming out at 39% is you're part of this community because you feel your donations are needed. And second is because Diabetes Canada aligns with your values. So thanks for taking the time to do that poll. And Dave, I think you have a question about education around type 1 for parents. Can I ask you to ask your question?
Yeah, can you hear me?
Yep, perfectly.
Okay. I'm probably going to butcher my question. I was trying to think of how to word it, but I advocate.
It's all good, Dave. Don't worry about it.
I advocate with Diabetes Canada. Like, I try to help out whenever I can and volunteer.
Thank you.
I thought we were, like, it was all good until a friend called me, and his 5-year-old is what it was diagnosed with type 1. And he went to the hospital, and it was scary. I mean, I was a kid when I was diagnosed, so I can just imagine what the parent was going through. But he was only in the hospital for 3 days. And he called me because he was petrified, because he said they gave me a Dexcom and a prescription for insulin and to follow up with my doctor. And that was it.
Wow.
So my question is there anything in the works that can expand on how to help the parents of children diabetics, especially, but to help better educate them right out of the gate? Because it's going to be an ongoing concern, right? Diabetes is not going to go away tomorrow, but starting everybody off on the right foot is key. And I don't want to see any parents having to go through that particular scenario. I don't know if that's normal, if that's the new way, but I can imagine the stress level. So
Yeah.
I guess that's it.
I can imagine. Yeah. No. Well, great question and very clearly articulated. And Rachel, do you want to talk a little bit about some of what our patient education folks are doing around that, but also what our one of the organizations we partner with, JDRF, Juvenile Diabetes Research Foundation, is doing about what you're really talking about, Dave, is connecting people, right, and making sure that they have that support right at time of diagnosis. Do you want to talk a little bit about that, Rachel?
Yes, happy to. This piece about connecting with people and their families when they're newly diagnosed, it's so important, and there's so much information to take in. And I'm sorry to hear about the story of your friend feeling so overwhelmed because they didn't provide the support they needed at that time. There's a few activities ongoing at Diabetes Canada that are worth sharing. And I think I'll mention that Diabetes Front, there's an upcoming, I'll call it a conference for people living with diabetes at the end of the month. And it's a great opportunity to think about connecting and getting resources. And Laura mentioned recipes. There'll be lots of recipes there as well. And because there's such a need to connect with people and to get those resources. And I think it's a longer patient journey as well. So I would not want to suggest that Diabetes Canada Connect, which is the name of the event, is only for people newly diagnosed. It's about providing resources and connecting people living with diabetes to others to provide these tools. Laura, you mentioned JDRF. They have a peer support program that might be of help to your friend, and I know that there's like Facebook groups and things like that as well that provide support, because it's definitely one of the mission pillars at Diabetes Canada is to provide knowledge and connection to people living with diabetes.
Mm-hmm. And ideally, thanks, Rachel, and ideally in that situation, someone at the hospital or the family doc or the endocrinologist, whoever's going to be having the care, would be linking to Diabetes Canada, to the website, and say, here's a whole range of educational stuff. They would be linking that parent JDRF, because hospitals nowadays are very stretched. In the old days might have had some pamphlets, but really that's not the role they play anymore. But hopefully coming out with some connections, and please follow up with this, and with that would have been ideal. And we still do see that at times. It just sounds like it didn't happen there. So it is time. If you can believe it, the hour has flown by. I'm going to ask each of our panelists to share some very brief, because we're running out of time, closing remarks. And I know we had way more questions that we didn't get to. So remember, at the end of this, you will have an opportunity, if you want, to give your question, and then we can respond after this. So thank you. So Rachel, maybe I'll just start with you. Very quick. What's your overall impressions based on what you heard tonight?
Thank you. It was so nice to be a part of this panel. So thank you, everyone who joined us this evening. We really appreciate your questions. It's really helpful to hear where your questions are coming from. And as we think ahead for research at Diabetes Canada, I mentioned we're developing a research strategy right now. And obviously, people living with diabetes is at the center of it. And it's so important to think about how we maximize impact and what matters to people who are living with this chronic condition. So I really appreciate your time in joining us this evening.
Thank you. And Mary, quickly to you.
Thanks so much. I really enjoyed this. I'd love to continue the conversation. Like Laura said, we are at a really exciting time, seeing the benefits of our research efforts. And so I hope that people feel that excitement. I'm certainly leaving today with inspiration. I mean, some of the questions were fantastic research questions that we need to go address if we aren't already. And so just, a call out to thank you to all the public call-ins, because really that's what that drives and inspires us researchers. Thank you.
Thanks, Mary. And Grant, anything you want to add? Grant, you might be on mute.
Here I was worried about making up time, and I forgot to take off my mute. Apologies, everyone.
No problem. We've all done it.
Yeah. I think what I'd like to do, and to save some time, is just conclude with some words from Banting himself. And although they were written 99 years ago, I think it connects well with tonight's conversation. Quote, "The science of today is the research of yesterday, and today's research will become the science of tomorrow. A general practitioner can expect to at best treat 3,000 people per year, but because of research, more than 1 million patients are using insulin on a daily basis. To devote one's life to medical research is the greatest possible contributions toward the welfare of mankind. The problem is, though, doctors conducting medical research in Canada are suffering from a lack of funds rather than from ideas. We must beware the export of brains from the Dominion. We do not do enough to keep these trained young people in our midst." So I just want to conclude and say thank you to each of you on this call for answering Banting's challenge through your continuing support of Diabetes Canada. Dr. Jung's exciting research that continues to build upon the legacy of the work of Banting Best, Colton McLeod, and all those who preceded them, is just one example of the many research projects funded through your generosity and support. Together, we can bring this to an end. Thank you.
Thanks, Grant. Very inspirational. And I just want to echo everyone to thank you for your time. I do want to say, I know I see lots of questions that we didn't get to. So if you have a question that wasn't addressed, please, at the end of this, you just stay on the line and you can leave a message for the speakers and staff, and we will be back in touch. It's been a wonderful town hall tonight. I'm glad we were able to speak with so many of you. I wish we could have spoken with more. And so I just really, as the CEO and president of Diabetes Canada, but also as someone who lives with type 2, I want to thank you. I want to thank you for your interest. I want to thank you for your support. And I want to wish each and every one of you a good evening tonight. So thanks so much. Take care.